Good morning, everyone. I am very pleased and honored to be with you in this virtual conference. Firstly, I'd like to introduce myself. I am Ryan Operario. I am a special education and mathematics teacher for blind and low vision students at Zapatera National High School, Division of Cebu City. I myself am also a low vision, diagnosed with LHON or Leber's hereditary optic neuropathy, and I'm going to share with you this session on dealing with a low vision patient. The objective of this session is for you, the participants, to be aware of the social and physical skills needed when dealing with a patient with low vision. This image on your screen right now is a person who is using a mobility cane, which is a universally accepted symbol for blindness and low vision. In addition, this depicts a person who is determined to access different environments. And I hope that through this webinar, I'll be able to capacitate and empower you to embrace and adopt principles of accessibility and inclusion, particularly for your patients with visual impairment. To begin with, I have here some basic yet essential steps or tips in assisting a person who is visually impaired in your facility. The first one here is the three A's, which stands for approach, ask, and assist. Now, a person who is visually impaired might be observed to have some difficulty navigating around your facility. So, halata no, na sila ay may problema moving around or finding a certain uh, area in your facility. Now, if you see them at far or you see them in your facility already, then kindly approach them and introduce yourself. No? And next to that is you ask if that person needs your assistance. So asking is very essential because if the person is already oriented with the place and he would refuse your offer of help, then that still would be fine. No? Okay lang naman yun. And of course, if the person accepts your uh, assistance, then you proceed to the to assisting him, no, in whatever he or she would like you to uh, help him or her. One of the things that people who are blind and low vision like is for people to call them by their names. Calling them by their names is like making an eye contact to them. Another tip is to directly communicate to the blind or the low vision person. If you have any concern or if you want to get an information, you just directly ask the the blind or the low vision person. If you are giving instructions, be precise in the language that you're going to use. Words like here and there do not really make sense to us. So be precise and also be descriptive in the instructions that you're going to give us. If possible, kindly describe to the blind or low vision patient everything that is going around him, particularly the procedures that will be performed to him. And also, if you're entering or leaving the room, please notify him or her. Now, if your time permits, kindly orient the blind or low vision patient of your environment, particularly the important areas in your facility, like the restroom, the doors, the fire exits, and the other things that are very important for his navigation. At this point, let me share with you a technique that is very useful in assisting blind and low vision persons in different environments. This is the sighted guide technique. As the name suggests, there's a sighted guide who will be walking with or guiding a person who is blind or low vision safely and efficiently in a particular environment. The first step in the sighted guide technique is to do the three A's which I mentioned earlier. Approach, ask, and assist. If the patient accepts your offer, then it's your turn to tap the back of his hand, which is a clue for him to trail your arm and position his hand just slightly above your elbow. But if the patient does not know this or is not trained to do this, then it should be your responsibility to inform him to trail your arm and position his hand on that part just slightly above your elbow. When walking with a blind or low vision patient, just walk in a normal pace, and the patient should be approximately a half step behind you. When walking with a blind or low vision patient, just walk at a normal pace, and the patient should be approximately half step behind you. Now, this is to avoid tripping of feet. If you're approaching a door, inform the patient that the door opens to the right or to the left. And if needed, you can also position him at the hinge side of the door, yung bisagra na side. And you can also take his free hand so that he will be the one to open the door. In this way, hindi masyadong mahirap sa inyong dalawa ang pagpasok if you're trying to enter a room or to exit a room. When you're approaching a drop-off or steps, try to slow down. This can be a clue to your patient that you are going down or you're going up. But you can also inform him, no, verbally, that you are approaching or you're going down or you're going up. In narrow spaces, what you can do is to put your hand at your back, which will serve as a signal for the patient to change his grip, you know, from the elbow part going to your wrist. And pag binaba niya na yung grip niya, this also means that you are forming a single file. So you can uh, pass through a narrow space na parang iisang person lang kayo. If you're going to sit a blind or low vision patient, try to place his free hand, yung hindi ginagamit, doon sa back part ng chair. And this would be a clue for him na that is a chair and he can pull it. And before sitting, he needs to scan it with his other hand just to check kung wala bang nakalagay doon. And after that, he can actually sit na. Here are other tips and reasonable accommodations. When transporting a blind or low vision patient to the operating room, you can make use of the sighted guide technique. At pag nasa loob na ng operating room, try to provide a quick orientation on the things that are inside the operating room. Sa case naman ng slit lamp, pwede kayong magbigay ng verbal instructions on how the patient can position his head. If you're giving away printed materials to your blind or low vision patient, kindly convert these materials into accessible formats such as braille, large print, or audio. Now, in most cases, hindi pa marunong ng braille yung mga patients. So what you can do is convert these materials into either large print or audio formats na lang. If you're interacting with a blind person or a severely low vision person, try not to disappear in the middle of your conversation. Apparently, hindi niya makikita if you are still there or wala na. So that's embarrassing pag umalis kayo. Yung mga partially open doors, cabinets, and other structures na partially open ay really hazard for people who are blind or low vision. Kaya as much as possible ay keep it open, wide open, or close, talagang close. Do not avoid words like watch, see, and similar words. People who are blind or low vision also use these words. Na hindi naman kayo pwedeng gumamit ng uh, touch you later, no, instead of see you later. So still use watch or see. For paperworks that require the signature of the blind or low vision patient, kindly read to him or her the contents of the document. And kung magsasign na, kindly use a signature guide, kahit yung ID, para magiging guide niya sa pagpirma. Other accessibility features that you can adopt in your facility are the following. For signages, it is recommended that you have it in Braille and also should be with high contrast. No? So kung may signages, uh, preferably for low vision patient ay yung yellow na color. And also yung consistent lighting. Another thing is yung contrast ng mga specific areas ng facility. For example, sa restroom, hindi favorable na it's all white. No? So dapat may contrast yung floor and also yung wall and the other also areas of your facility. In the case of your newly blind or newly low vision patients, you can refer them to non-government organizations like Resources for the Blind for rehabilitation services. Pwede rin sa pinakamalapit na SPED center na merong SPED for the visually impaired program. Pwede rin sa Area Vocational Rehab Center ng DSWD para magkaroon ng training, no, on vocational and rehabilitation. And also, sa pinakamalapit na PIDAW o yung Persons with Disability Affairs Office ng inyong LGU. Pwede nyo rin silang mai-refer sa PAVIC, isang support group ng mga parents or yung support system ng visually impaired children. So PAVIC stands for Parent Advocates for Visually Impaired Children. At isa pang support group ay yung My Refuge Low Vision Support Group. So ito ay binubuo ng mga low vision katulad ko. At of course, meron din tayong mga online or web-based na mga support groups. With that, allow me to thank you for listening and God bless us all.